Now we have with us Amy Landry, in the Client Services Department for Mingle, and our subject matter expert on the APM Performance Pathway, the APP. Before coming to Mingle, Amy had a broad and varied career in marketing, insurance industry, nonprofit healthcare clinic management. So she's been a good find for us and a great help. Uh, Amy, are you ready to answer some questions about the APP?
I am.
So, why don't we start with just in general, what do ACOs need to know about the APP transition as it applies to the 2023 rule?
Well, web interface reporting is still available, but it's going away. So it's time. Transition now. There's definitely some incentives for biting the bullet and just making the switch. Um, CMS did, in the final rule, extend the incentive for reporting via the APP through 2024. So this means that they've lowered the quality performance threshold for those reporting via the APP to just 10th percentile for one outcome measure, and then the 30th percentile in one other measure. Whereas if you stick with reporting via web interface, you need to still have an average performance in the 30th percentile across all 10 web interface measures. Another benefit to transitioning now is a potential 10-point bonus with a health equity adjustment that they newly put in this final rule and that will also be added to an ACO's MIPS quality performance category score when they report via APP. And that's based on their quality performance and providing care to a higher proportion of underserved patients. And CMS will use an area deprivation index score to assess their underserved populations, and you won't know in advance how many of those points you'll get, but after they've scored everyone, they'll determine what bonus, and that will range anywhere from 0 to 10 points in that regard. But mostly, I think what we know is that if you haven't taken advantage of the gift of time CMS has given you to transition to APP, now's the time to do it. Entering the program with the reduced thresholds is an opportunity you don't want to pass up. Plus, with all the buzz that health equity is getting, it would not be a surprise if come 2025 there are new reporting requirements in that arena. And it would be a tough undertaking to begin all payer data collection, attain a quality performance threshold in the 40th percentile across all measures, and potentially new health equity initiatives all in the same year.
Thank you very much, Amy. It's been very informative.